I learned about ICHS through my mom. So it was about 15 years ago I first volunteered at ICHS.
I think ICHS is important because it helps people who can't afford to go to other doctors.
It's for people that don't have insurance.
2 years ago, when I was having problem with my teeth, and as you know, it's very expensive to get dental coverage, and we don't have good coverage because I'm the only staff here at Helping. So I was looking around, and I called ICHS, and he said, well, come on down, we have a dental clinic here.
Yeah, my grandpa and my grandma goes here because like they don't have that much money, so they just go here and to get insurance and stuff and medicine when they're sick.
I've been coming to the ICHS for as long as I can remember, since my mom had me, and it's been over 20 years ago.
At ICHS, the doctors know the patients, they know the names of the patients, the family, the kids.
I've been seeing Sweat since
17 or 20 years.
20 close. So I started in the clinic in 1989, and it was shortly after that I saw you for your pregnancy with Amanda. And so I took care of her with that. You are the only woman that I have delivered 3 babies for.
I think that's what sets us apart, is that, you know, our staff focuses on being family oriented.
We came here back in 1988 as a refugee.
My mom has worked for ICHS my whole life, so whenever there's been events or stuff that they need volunteers, I'm automatically volunteered to help out.
Winnie is my younger sister. We were apart by about 8 years. And so when she was born, I was in the room with my mom, and I had been taking care of her since she was little.
This is my 15 years. ICHS just become like my second family.
Three years ago, my sister was diagnosed with an inoperable brain tumor.
I remember he sat on my bed and he just looked at me and he said, "You have less than a year to live. There's nothing I can do."
When I found out that she was diagnosed with, you know, this brain tumor, I was scrambling on the internet trying to look for a cure, and it was inoperable, so there was no cure. We were told that she had only 6 months to live.
And I just remember, I didn't cry because it was just like, someone tells you something like that, you don't feel anything.
In addition to trying to kind of balance the emotions of different family members, I remember sitting down and talking to the doctor, and I said, well, what are we going to do with these costs? She's been in the hospital for, 3-4 weeks at this point, and we had to try to plan for a funeral.
My mom didn't go to work for 6 weeks so she could sit by my bedside. And my mom likes to work, so I bet she was just, I don't even know what she was going through to see, like, her daughter go through something like that.
So when she went into Children's Hospital, we thought that that was where we were going to say goodbye to her. But, within a few months, we were told that it was a medical mystery. We didn't know what had happened, but she had recovered. And I'm really thankful to, uncompensated care for that, because we were able to spend time with her and kind of give her the time she needed to recover. And I think that's why uncompensated care is important to me, and that's why I serve on the board of ICHS. I think after going through that experience, uncompensated care is something that is close to my heart, and also for my family, and so I'm committed to raising money for uncompensated care. I think that should be #1 priority moving forward.
From past experiences, from coming here and seeing the staff and the providers, especially Dr. Kimo, and what he does, his work, it really kind of pushes me to like I want to be that person, like having an impact on someone else's life. I want that for my future. You know, I want to be able to like help others. You know, be able to like interact with them.
For a refugee and immigrant family, it's difficult when you send them to somewhere that they're not familiar, and the staff, you know, are not bilingual and not, you know, culturally sensitive. It's scary, you know, to go get treatment when you don't know what the doctor is going to be doing to you. So I think having the language and the culture ability is a plus, and you know, being in the neighborhood is so much nicer.
I feel like connected, like with the patient, like just like when I first came to America, I feel like I have the connection, like helping people that don't know anything when they first got here, even though they're here, but they don't speak the language. And then I feel some connection between myself and patients.
It's nice to see that there's a big push to help the people just coming here with healthcare if they don't have the means of like language barriers and money and stuff like that.
Without it, I think a lot of people like really actually wouldn't know what to do. Like they wouldn't know where to go. And
ICHS is very unique in that way, where there's the cultural competency piece. I think our services are unique. You know, especially the breaking down the language here.
I think everybody has the right to have healthcare because everybody has the right to live a good life and not be sick.